Hair loss isn't just about stress, and it's not always about aging either. In many cases, especially in both women and men under 50, hormones play a major role. And understanding which hormones are involved can help guide not only treatment, but your expectations. Let's start with androgens, or male hormones. The most well-known form of hormone-related hair loss is androgenetic alopecia, commonly called male or female pattern baldness. It's genetic, yes, but it's also hormonally driven. In men, it's typically linked to dihydrotestosterone, DHT, a byproduct of testosterone. DHT binds to hair follicles, especially around the temples and crown, and causes them to shrink over time. Eventually, the hair becomes thinner, shorter, and stops growing altogether. In women, the pattern is different, more diffuse thinning at the top of the scalp. But the mechanism is often similar. Increased sensitivity to androgens, or hormonal shifts that unmask that sensitivity. Now, let's talk about estrogen and progesterone. During pregnancy, estrogen levels are high, and hair tends to grow thicker. But after delivery, when estrogen drops, many women experience telogen effluvium, a sudden, diffuse shedding that typically resolves over a few months. The same thing can happen around perimenopause or menopause, when estrogen and progesterone decline and androgens become more dominant. Thyroid hormones also matter. Both hypothyroidism and hyperthyroidism can cause hair thinning. If someone comes in with sudden diffuse loss, checking their thyroid is standard. Then there's insulin resistance and PCOS. Women with polycystic ovary syndrome often have elevated androgens, which can lead to both scalp hair loss and increased facial hair. So what can you do? First, get evaluated. Don't just assume it's genetic. Check your thyroid. Check your ferritin. If you're a woman, check androgens and possibly insulin markers. Topical minoxidil can help in many types of hair loss. Finasteride or other anti-androgen therapies may be appropriate in hormonally driven cases, especially in men or in women with PCOS. But be cautious with supplements. Just because something is natural doesn't mean it's effective or safe. And lastly, manage expectations. Hair cycles are slow. Regrowth takes time, usually 3 to 6 months to even see a difference. Here's what I tell my patients. If your hair is thinning, your body might be trying to tell you something. Let's listen to it before we try to cover it up.